Hi, everyone. Welcome to this episode of MedTech Minis. I'm your host, Susie Ingwell. Today, I am here talking to a startup that I am excited about because they are tackling some of the challenges that we have in the mental health care space. So with that, I'd like to introduce you all to Mikkel, who is the CEO and founder of Mindsigns Health. Thank you so much for joining us today.
Thank you for having me.
Why don't you start by telling us a little bit about you and the problem that you set out to solve?
So I'm the CEO and co-founder of Mindsigns Health, which is a company based both in Singapore and the US, and we're a spin-off from one of the technological universities here. And what we do is we're a suite of cloud-based tools for neuropsychiatry. So disorders like epilepsy, schizophrenia, major depressive disorders, all those are under the umbrella of neuropsychiatry. And what we do is we collect a lot of different types of information to infer insights, help with treatment monitoring, symptom evolution, and eventually, hopefully, better outcomes through more timely interventions.
I like that. So what kind of gave you the passion to take this on? What was your motivating factor?
Well, I mean, there's always a story behind, an entrepreneur starting something, right? And so in my case, mental health issues, there've been mental health issues in our family, etc., and friends, and leading to disastrous effects. So, and also visiting a lot of hospitals. I've been doing this for quite a while, and you can see that technology is needed, especially these days, as the hospital systems and all the healthcare systems are under a lot of stress, both from a human resource point of view, but also financial stress. So what we're trying to do is kind of bridge all this with technology. So bridging technology and healthcare, and then patients and doctors. And that's kind of the modus operandi of our DNA.
I think that's great. I mean, I know there's a huge shortage of mental health professionals in the US and in other parts of the world. And I know a lot of times, if you've got an issue, a lot of these patients end up at the ED for 2 or 3 days waiting for a bed. A lot of crazy stories out there about, what people had to endure to get the services that they need. So I'm so glad you're doing this.
Absolutely.
Tell us a little bit more about your solution and what you guys, how it works.
Okay, so it's, as I mentioned, it's a platform, and we have 2 products on this platform, 2 main products. They're both software-based products. So one is an automated EEG software. And what it does is picks up signals, EEG signals, which are brain abnormalities in terms of circuitry, analyzes those, and then serves them back to the neurologist or the EEG tech. And the validations we've done, especially in Singapore and in some of the hospitals, have indicated that we can save up to 75% of analysis time, which translates into a lot of savings in terms of EEG tech, neurologists. And that, again, translates into additional revenue for hospitals, but also the ability to see more patients, right? Because as you said, there's a shortage of practitioners. So that's on the EEG side. And our customers, even though the patients benefit, our customers are really the hospitals or the specialty centers, right? On the other side, we have another product, and that's linked because, again, neuropsychiatry, and that's for mental health, and that's a remote monitoring product. So what we do is we're able to capture information that everybody knows is out there once the patient leaves the therapist's office or psychiatrist, but they don't have access to it. So we capture that information, we serve it back to both patients and clinicians in a series of dashboards with different language, obviously, with the healthcare practitioner, we use all the jargon. With the patient, we use things more like, this is how much sleep you get, this is the quality of your sleep, how do you feel today, et cetera, et cetera. So, and we do it with a very simple instrument. It's called a mobile phone, right? So we record your comment. Yeah, exactly. We record your conversation, and we don't have to record all day, just 30, 40 minutes a day at specific times. And we ask for your consent every day. If you agree, fantastic. If you don't agree, that's also good. because then we trigger a set of questions which are called EMA, which is ecological momentary assessment. And from that, we can get at least some idea of what your mental status is. And so that's what we do. So we do all this remotely. And we started with schizophrenia and depression. And so we're looking at trends of a majority of symptoms in what's called negative symptoms and cognitive impairments. And those are really the debilitating symptoms, because the psychosis part, although also debilitating, it's druggable. Negative symptoms are not.
Well, this is really fascinating. I feel like I could talk to you for another hour about this. Unfortunately, we are out of time. How do people get in touch with you if they want to learn more like I do?
Then they can reach me by email. So it's Michel, Michel, .b, as in Birnbaum, at mindsciencehealth.com.
Awesome.
And obviously our website as well.
Awesome. I will have it on here at the end as well. Thank you so much for your time today.
Thank
love to have you back on again as you guys move forward.
Thank you very much for having me. Have a great day. Bye-bye.